I can't tell you how many ambulances there were. They just seemed to go on forever. I was walking along the side of the building and they're all queued up on both sides of the road.
It was the police who called for an ambulance after they found Hannah's dad lying on the floor of his home last week. He's diabetic and had a fall. He'd been there for almost 2 days. But when he arrived here at Peterborough Hospital, he endured another 12 hours waiting inside an ambulance to be admitted, and then a further 24 hours waiting in a corridor.
They just had so many people in A&E. You walk in there and you're climbing over people. There are people sitting there with drips on in the corridor. There was blood on the floor, injured people everywhere. It was just, I couldn't actually believe what I was seeing.
Peterborough Hospital told Sky News they're doing all they can to reduce waiting times in their emergency department, including redeploying more staff. Talks between the Health Secretary and union leaders on Monday failed to find a breakthrough. The government is sticking to pay review body recommendations, a process unions say they will no longer be a part of.
What we need is the government to listen and to get around the table and to start negotiating better pay deals, better terms and conditions for all NHS staff, not just our ambulance colleagues.
The relationship between union and government is even more tense after a new bill was introduced to enforce minimum service levels for the public sector during strike action.
All we're saying is that in these emergency services, patients should be able to rely on a basic level of life-saving care. Why is he against that, Mr. Speaker?
There's not a minimum level of service any day because they've broken the NHS.
Strikes could not have come at a worse time with the NHS under so much pressure. Patients are already at risk with lengthy delays to response times and handovers.
According to the Office for National Statistics, we're recording some of the highest excess deaths we've ever seen. In the last 6 months alone, there were 1,300 deaths every week over and above what you would normally find. COVID accounts for some of these deaths, but according to health leaders, most are being caused by the crisis in the NHS.
Ambulance workers say they're fighting for better pay and to improve patient care. But industrial action puts more pressure on a buckling NHS and almost certainly more patient harm. Ashish Joshi, Sky News, Central London.